Hello anatomists, and welcome to an eye dissection with Mrs. and Mr. Foes. So here we have a cow eye. We've just taken it out of the packaging, and you'll see that there's a lot of external tissue attached to the eyeball. You'll see that there's several muscles, those extrinsic eye muscles like superior and inferior rectus, medial and lateral rectus. There's also fat. What you'll see coming out of the back is the optic nerve, and we want to be sure that we don't damage that right there. Okay, so what we're going to do is we're going to start to trim away some of that extraneous tissue. Here's some more of that removal. We're almost there. So now we've removed the external tissue surrounding the eye, and we've exposed the optic nerve in the back. So the first thing that you're going to do is make a slight incision on the cornea. The cornea is the clear window in the front. Making sure that you're not going to hurt. Well, that was the aqueous humor, which is in the anterior or front chamber. That escaped there. Okay, so now we're going to do a coronal cut on the eye just behind the cornea. There's some more of that aqueous humor. It's important for fluid to be in the eye to make the right pressure so that you have proper vision and the retina stays in place. So we're going to cut all the way around this. Okay, and now we've divided our eye into two sections, an anterior and a posterior. What we can see first here is the vitreous humor inside, which is real thick and gel-like, attached right behind the lens. So you can pull out the lens. So the lens would be clear, and it helps focus light. It slightly changes shape based on the ligaments that pull on them to focus closer or farther away, and it's normally clear. If you look at your fingertip real close to your face and then you look at the far wall, your focus changes distance using your lens. And so that gel-like stuff attached there is the vitreous humor. That's in the posterior chamber. It's much thicker. Some hair gels actually use it for its gel-like qualities, and that helps maintain the intraocular pressure. Okay, and now he's going to clear out the posterior chamber very carefully because the retina is just sitting there. Oh, looks like it's pretty good. Okay, so our eye has three layers: the outer fibrous layer, the middle vascular layer, and the inner retina layer. Okay, the fibrous layer on the outside is real thick. That's the white part of your eye in this case, the sclera. So sclera. Then the black is going to be our choroid. So this vascular layer all the way throughout the eye looks black. The portion in the back here is the choroid. And you'll notice that a cow eye has this lovely reflective coating on it. Human eyes don't have that. That's called the tapetum lucidum, and it is for night vision. It reflects light against the retina a second time so that you get better night vision. That's why if you shine lights at a cow's eye at night, they glow just like a cat or dog. They all have that structure. We do not. And then this inner layer that's very thin, and you could easily move it away by accident, is the retina. So part of the retina is going to be your photoreceptor cells. That's where light goes to focus. We've got rods and cones. Rods do dim motion lighting. Cones are color. And right here, this point is called the optic disc. It's your blind spot, which is going to be connected directly to your optic nerve. Right there. So any light hitting here, you're not getting information on. A close ways away, you're going to have your macula lutea with the fovea centralis. that's your best vision. So whatever you're focused on that you're looking at, the light is focused there. Lots of cones. Okay. So now let's look at the anterior portion of the eye. Okay. So for our fibrous layer, we've got the cornea. It's clear. It allows white light through. It's avascular, so it's easy to transplant corneas. However, there are a lot of pain receptors here. So that's why if you have a contact in and something gets in there, it's very painful. Around the whole outside of your eye, you'll also have conjunctiva, a thin membrane. If that gets inflamed, it's conjunctivitis or pink eye. Okay. So let's cut into the cornea and remove it. You can use the scissors. Be careful not to hit the dark part behind it. So we removed our cornea, and now we can see our vascular layer here. So this portion right here is the iris. So the iris is a muscle that controls this space. That space is the pupil. The size of the pupil, as determined by the iris, determines how much light you bring into your eye. So if it's really bright out, you don't need very much light to see well, so your pupil will be smaller. If it's really dark, you'll dilate that pupil. It will get bigger to take in more light information to get the best picture possible. So the iris is a muscle that contracts to control the size of the pupil. That's the colorful part of our eye. And the pupil isn't an actual structure, it's just that space that light moves through. So now let's flip this over and look at the interior view. So we can again see our iris here. And then it may be hard to see, but all around there, there's this rigid portion. It's very bumpy. That is your ciliary bodies. So with suspensory ligaments, those ciliary bodies hold the lens in place. And so there we're going to pull the lens to change your point of focus. Okay? Our lens is already detached, but had it not been, we could have shown you how as you slowly remove the lens, you can see those suspensory ligaments being pulled out. And then we'll leave you with a summary. So to summarize, the eye has 3 layers. The outer layer is the fibrous layer that's really thick. You've got your cornea, the clear window in, and the white part, very fibrous, very thick if you pull on it, the sclera. So cornea and sclera. The middle layer is the vascular layer, which is dark. That consists of the iris, which controls the size of the pupil, that space, the ciliary bodies that hold the lens in place, and the choroid layer, which in cows has that shiny tapetum lucidum for night vision. Then the inner third layer is the retina with our photoreceptors, rods and cones. In our anterior or front chamber, you have aqueous humor, which is really watery. In the posterior chamber, you've got your vitreous humor, that's gel-like. In between those, you have the lens, which is clear and focuses light. So now let's look at a few of those special features of the retina. You've got your optic disc, the blind spot, where you're going back to your optic nerve. There are no photoreceptors there. There's the optic nerve. And then on your retina, you've got that point. It'll appear dark if you look at it under a scan, where you've got the macula lutea with the fovea centralis, your best central focus with the most cones. And those are the main parts of a cow eyeball. Have a great day.